Now, the way this pandemic has changed our lives can severely impact our mental health. And as 41 Action News reporter Jordan Betts shows us, medical experts are seeing the detrimental effects.
We've seen an increase in not only the suicide hotline numbers, but the attempts have been more serious.
Experts say suicide is a growing concern during the pandemic. Data showing the volume of calls on the rise and the types of calls even more alarming.
So kiddos are doing more serious things to attempt to take their life.
University of Kansas Health System Mirror Lake campus that helps kids with mental illness told 41 Action News back in April that they were seeing a decline in patients. They believe the virus was making patients and their families not come in. Now, that's not the case.
Overall, for summertime, our numbers are probably 50% higher than we typically would see.
There's also an increase in calls to the Johnson County Mental Health Hotline.
Crisis line, may I help you?
We've seen over the last 17 weeks about a 30% increase in the number of calls, both during the day and at night.
The director of the mental health department says they are hearing about people taking their lives on a weekly basis.
What we've seen since the pandemic started is we're aware of 23 deaths by suicide over the last 17 weeks, and that is unfortunately at a higher rate than we saw last year.
So places like Joco Mental Health are ramping up their hotline staff to try to help as many people as they can.
When the COVID pandemic started, we quickly saw that we were going to need to bolster the staffing there. So we have 3 staff working 24 hours a day to cover the calls.
Professionals say fear of the virus should not stop you from getting mental health care.
Let's provide ourselves some grace. Let's provide some kindness to one another.
Jordan Betts, 41 Action News.